Are you suffering from cyclic-related migraine? You know it's coming every single month. Maybe it's just once, maybe it's 2 or 3 times, and it's affecting your quality of life. If you go to the doctors for conventional medicine, which I also practiced to 2018, you'll be given probably some medicines to reduce the pain and the migraine. But the real question is, why do you have these symptoms at all? Why do you have migraine at all? And why does it come through the cycle once or twice or 3 times, whatever frequency you have it? That is the real question, so that if we could fix the underlying dysfunction or the underlying issue, you may not need then pain-reducing medication. Obviously, one thing that we need to investigate if you're suffering from cycle-related migraines would be your sex hormone. If you have a dip in your estrogen at the wrong time, that could trigger your migraine. And that could be once or twice or thrice or maybe even more frequently through the cycle. Even in some women, progesterone changes can cause migraine. But there could be other reasons. It could be other hormones like cortisol, DHEA. If you have neurotransmitter issues like serotonin, that can also cause you to develop migraines. In some patients, it's a matter of deficiency in magnesium, B6, B9, B12, or maybe fatty acids. If you're deficient in those, then that can trigger your migraines. For each patient, it may be different. The symptom may be the same. You may have a cyclic migraine like the other person, but in your case, it could be a drop in estrogen. In someone else's case, it could be something with their cortisol level. And a third person may actually have some serious deficiencies that are causing the person to develop migraines. And our treatment and investigation has to be tailored accordingly. So if we want to find out what's happening, we might do conventional blood tests. Conventional blood tests can help us to understand whether you have some deficiencies. We can check the level of your neurotransmitters, your sex hormones, and other hormones. We can do stool sampling to see whether there's something off with your gut bacteria. We can also do other tests to get into more details about how's your metabolism working. We may need a urine test for that. Using these more advanced testing methods, we can actually narrow down what could be the reason for your cycle migraines. And in that case, we can be more specific in our treatment of exactly your issue. So if you're ready to address your cycle-related migraine, you can speak to us. We can book a discovery call where we will be able to see whether or not we're a good match, whether we are likely to be able to help you, and whether you're comfortable working with us. So thank you for watching this video, and see you soon for the discovery call.